Good afternoon, and welcome to our product showcase for SimNewB. My name is Samantha Bls, and I am the U.S. Marketing Manager for the Maternal and Newborn portfolio here at Laerdal. I'm so glad you're joining us today to learn more about simulation solutions that can help healthcare providers deliver the best possible care to neonatal patients. As I'm sure you know, the greatest risk of childhood death occurs during the neonatal period. Research indicates that birth asphyxia is one of the 4 leading causes of neonatal deaths. Of the estimated 7 million neonates born worldwide, 1 million babies died due to perinatal asphyxia, all of which correspond to the failure to initiate and sustain normal breathing. Because the need for assistance is not always predictable, teams need to be prepared to respond quickly and efficiently to ensure the best possible outcomes. This can be addressed with simulation training specifically targeted to help prepare clinicians for the complex needs of newborns. SimNewB was developed in collaboration with the American Academy of Pediatrics to meet the specific learning objectives of the Neonatal Resuscitation Program, specifically on resuscitation and stabilization protocols for newborns. In addition to training with SimNewB, you can utilize a variety of solutions to create a comprehensive neonatal training experience for your learners, like pairing it with scenarios developed and validated by the AAP, including 8th edition NRP curricula, or integrating debriefing to capture, share, and improve your training sessions. Depending on your learning objectives, we can help you implement the tools you need to succeed. During today's session, you'll have the opportunity to view an in-depth overview of the clinical features available with SimNewB, followed by a Q&A session. If you have a question or a feature you'd like to see, please type it into the Q&A box on your screen. We encourage you to continue to ask questions throughout the presentation to ensure this is an engaging and meaningful experience for you. Now I'd like to turn it over to our presenter, Rotera Smith, one of our educational services specialists, to walk you through SimNewB.
Hello, thank you, Sam. My name's Rotera Smith, and I've been a registered nurse for over a decade. I spent a majority of my time in the Pediatric Emergency Trauma Center in Washington, D.C. I have been with the Laerdal family for 2 years. I am so excited today that you have joined us to go over the features of SimNewB. In today's showcase, we will be using the Simpad to operate our SimNewB. This is just one of the facets that you can utilize to operate your simulator. While transitioning from extrauterine life is a seamless process for most newborns, others have complications. In the first 10 minutes of life, SimNewB provides that high-fidelity solution to provide care for those patients who require further assistance. SimNewB provides learners the opportunity to practice realistic airway assessment and management and effective team communication in those critical situations. Its robust feature set provides realistic learning opportunities for those in professional education as well as the healthcare setting amongst the interdisciplinary team. From the delivery room to the NICU, SimNewB Tetherless provides hands-on, real-time, realistic training. This simulator can present as a listless, cyanotic newborn or a crying, moving, vigorous newborn. Learners can practice all aspects of neonatal care and resuscitation. Some of these things include positive pressure ventilation, endotracheal tube insertion, and post-resuscitative care. These features are critically important when going through the steps of NRP. Utilizing SimNewB and the Scenario Cloud, you are able to practice the curricula of the 8th edition NRP. Now, let's move to the features of SimNewB. Because I'm a nurse, formerly of the ER, we're going to start with a primary survey that goes through A, B, C, D, E to go over the features of SimNewB. So, let's take a look at SimNewB's airway. If you look inside SimNewB's mouth, he does have a tongue, as well as all of the anatomical realistic features that a newborn would possess. This airway can accommodate an ET tube, an LMA, or an iGel for an advanced airway solutions. Also, you are able to program in resistance and compliance and variable recruitment for those first few minutes of life. As you can see, SimNewB is breathing and has adequate chest rise and chest fall. These respirations can be programmed at any rate you desire. Also, whenever you're intubating SimNewB, there's a possibility that you're going to go right main stem, and that is when you'd be able to visualize that unilateral chest movement. Another feature of SimNewB is the ability to place an OG tube or an oral gastric tube for stomach decompression during that first few minutes of life to be able to provide intervention. All right, let's practice some airway techniques with SimNewB just to give you a visualization. All right. So first things first, we're going to practice that PPV or that positive pressure ventilation. I'm going to grab my BVM. Always make sure that your BVM is the correct size for your patient. And you're going to go ahead and place a great seal on there. And one thing I'm going to do just to give you a great idea and visualization, I'm going to turn that respiration off just to show you that I'm truly providing that PPV. So right now, there is no respiration. As you can see, the chest wall is not moving. And then I'm going to head tilt chin lift and provide those full breaths to SimNewB. And that's just one option that you can see. Also, anytime you're providing assisted ventilations, your Simpad will let you know that you're giving those breaths to SimNewB. Now, let's move on to intubation. Of course, you need a laryngoscope. And you're going to want to lube your equipment, not your patient. Okay, that's done. So I'm going to grab my tube, put some lubricant on there, pull my stylet back. Don't want to cause any trauma. Then let's look inside this airway. All right. Alrighty, I think I see let's come back some. All right, I found the vocal cord and the trachea. We will see. All right, I feel the carina, so I'm probably too far, but we will check and see. All right, give me 1 second. All righty. Nope, clearly I'm right main stem. Great teaching point. So what we're going to do is go ahead and pull that back just a tad. And now I have good bilateral chest rise and chest fall. Awesome. So take that off. And I will extubate SimNewB. And we will continue to move forward. Alrighty, let's give him some respirations back. As you can see, he is breathing in our happy, healthy baby once again. Next, we will move on to breathing. SimNewB offers a multitude of breathing options. These include, as we just talked about, spontaneous or assisted respirations. You can simulate the O2 saturation here on your patient monitor, and that can be set at a variety of settings. Anytime that you take SimNewB's oxygen saturation below 88, he starts to become cyanotic around his mouth. And the further you drag that saturation down, the more illuminated that will become. Also, he has a unilateral thoracentesis site in which it is mid-axillary and you are able to decompress that. Moving on, SimNewB also has cardiovascular components as well as circulatory components. Speaking of the heart, SimNewB, you're able to recognize CPR start-stop. So anytime you start CPR in one of your critical care situations, you're able to recognize that feedback on your Simpad. There's an expansive ECG library that you can program for those sentinel events, and you can program the heart rate anywhere between 10 and 300 beats per minute. Also, as you can see, there's a simulated ECG. Right now we have a happy baby at a good 141 and a 98% O2 sat. As far as circulation is concerned, SimNewB offers 3 pulse sites, and those are super important. You have the 2 brachials, so one here and one here. One thing to note about those is that once you palpate, your Simpad not only gives it a timestamp and recognizes that it's been palpated, but also that's a good way to test your learners to see if they're truly assessing those pulse sites. Also, if you press too hard, you will occlude that pulse site just like you would in a real person. The third pulse site is going to be your umbilical pulse. That pulse, all of these pulses are dependent upon what rate you set your heart rate at in your Simpad, and that can be variable based upon your situation. The last part of circulation I want to discuss is going to be the hydration or fluid resuscitation component. So SimNewB offers 3 sites in which you're able to provide fluid resuscitation. Those include the umbilical area that has 2 arteries and a vein that can be utilized with high infusion rates for fluids, as well as 2 intraosseous sites in bilateral lower extremities. These 2 components, what you're going to do is take your finger, feel for that tuberosity, and then take either your EZ-IO or your manual driver and drill into that spot, and then you will have your access. It's very simple in the fact that it also offers a drainage system here in the bottom of the heel. Due to SimNewB being a simulator, he cannot absorb that fluid, so you are going to need a drainage system, and you would hook that up there and have it dependent under your workstation. These are the areas in which you can provide that hydration in those critical moments. Also, some other features of SimNewB. As I told you, I'm a pediatric emergency trauma nurse at my base, and so therefore one of the things that we used to have to deal with was non-accidental trauma or brain injuries, and in those situations there are pupillary differences that you'll look for. And so with SimNewB you have 3 different pupillary settings, and those settings include constricted, dilated, and normal. And to adjust those, what you would do is take your thumb or index finger, pull back this eyelid, and then take your other thumb or index finger and roll that pupil to wherever you'd want it to go. These are able to be rolled independently and be different, or you can make them both the same. Another feature of SimNewB is his ability to move. I love that. So first, what we're going to do, I'm going to show you his seizure components. So he can have bilateral arm seizures that look like this. Or it can be unilateral in nature, like that. Some other movements of SimNewB include a tone baby. So this baby is posturing currently. As you can see, the arms are stiff, they're not moving, and that would be an example of a brain injury or a neurological deficit that would be presented in that situation. Another facet of SimNewB is that he becomes a limp baby. So again, this would be one of those things where you would use an NRP where your baby would be listless, and as you can see, that head is limp, those arms are limp, and you need to provide some intervention pretty quickly. Last of SimNewB's features that I would like to discuss are going to be his sounds. SimNewB has a library of sounds, and we're going to go over some of those. With the vocal sounds, of course, he's a baby, so he's not going to be talking. But, of course, what do babies like to do? They love to cry. So SimNewB is able to cry, and you're able to program that into your Simpad. And so with the crying feature, SimNewB can be programmed to do those things as well. Next, SimNewB also has lung and heart sounds. Those lung sounds, again, are going to be normal, stridor, pneumonia, and then that's just a few of them. And then heart sounds as well. Normal heart sounds, murmurs, ASD, and VSD. These sounds are offered anterior only, and you can auscultate with your stethoscope, and the volume can be changed. Again, there's 2 ways to operate SimNewB. These include utilizing your Simpad, or you can utilize the LEAP software. The Simpad is more of a portable option in which you're going to do that in situ simulation where you're going to be moving through the ER or L&D to the NICU and be on the go, or you're going to utilize the LEAP. The LEAP is more of a suggestion in which you're going to want to use it in a control room or in a fixed stationary type of setting. Lastly, there's 2 other facets I want to discuss with you, and those are 2 solutions that can bring your simulation experience all together. These include Laerdal Scenario Cloud, which is a content delivery platform that is designed to improve outcomes with pre-programmed content for learners and users. And the NRP 8th edition curricula is in there to be utilized for that practice. And the last of these is the SimCapture. SimCapture is a single web-based interface that allows for recording, playback, annotations, and debriefing. This can be utilized in situ or in a control room setting. These solutions will bring your simulation all the way together from start to finish. Thank you so much for your participation and listening today. Now back to you, Sam, for Q&A.
Thanks, Rotara, for the great demonstration of SimNewB. Now let's get to your questions. So I see the first question in is about the size. What is the size of the simulator?
Great question. SimNewB is a 50th percentile newborn weighing 7 pounds at 21 inches long.
Thanks, Rotera. Next question I see is, what skin tones is SimNewB offered in?
SimNewB is offered in 2 different skin tones, the first of which being the one that we're utilizing for today's showcase, also known as the dark. And then we also have the light version of SimNewB here as well.
That's great. Next question is about the sound. So I know you talked about some of the sounds that are available already pre-recorded, but they were asking if sounds can also be recorded.
Absolutely. I have a happy, cute baby at home myself, and so some of those sounds I would love to incorporate into simulation. So you are able to use the LEAP interface and the sound recorder to be able to record some infant sounds in there that are different than the ones that are pre-programmed. Once that is done, you would then take your USB to micro USB and connect your Simpad to your computer to upload those raw files. With the Simpad, those files do have to be raw, and then you're able to play those sounds within your software.
Great, thanks, Rotera. Next question is, does SimNewB seize?
Absolutely. SimNewB has 3 different seizure options, and those look like this. We have the bilateral seizure, and then we have the unilateral seizure. And of course, the right arm does it as well, but for visualization, we're just showing the left.
Thanks for showing that. Next question, can you state again what 3 pulse sites are available?
Absolutely. So again, we have the bilateral brachial, so one on the left, one on the right, and also the umbilical cord. Again, if you palpate those bilateral pulses, you will get feedback recognition into your Simpad to show you that the pulses are being palpated, and then also the umbilical pulses here as well.
All right, next question. Are we able to do BLS and PALS, in parentheses, defibrillation on it? So I know we talked about NRP training, but what about BLS and PALS and then integrating it with the defibrillator?
So regarding BLS and PALS, yes, you're able to do those components outside of the defibrillation. SimNewB does not allow for live shocking. There's 2 options that you can do to simulate that. There is the shock link solution that allows you to integrate pads to the simulator, or you have the option of using your patient monitor to be able to show a defibrillator. And in that facet or setting, what you'd want to do is, of course, power on your defibrillator, because that's going to be important, and then touch here when pads attach to give you that simulated defibrillator and those options to provide that energy to the baby.
Thanks, Rotera. Next question, does it have Cpr feedback on Simpad?
No, it does not, but it does recognize when CPR is started as well as when assisted ventilations are being provided.
Okay, and then I guess kind of a follow-up question, another one we got was, does it have the ability to tell a learner if their rate and or depth of PPV and compressions is off?
No, it does not, because that goes along with the components of QCPR, but it does recognize the fact that you've started your CPR and you're off the chest, and it shows you when you stopped your CPR, as well as it shows when you're giving ventilations.
All right, next question. There's actually a few about this. Is there an option for chest tube insertion practice or just needle decompression?
Just needle decompression.
And then an option to do thoracentesis?
Yes. On that mid-axillary left side.
All right, next question. And can you insert umbilical lines and infuse fluids or meds?
Yes, absolutely. So as you can see, we have an umbilical cord. Your component or your set comes with quite a few. And so those look like this, and then you'll just take your trauma shears or some household scissors and cut it to your desired length. And after you do that, you'll put some lubricant on here and insert it in this hole if it does not go smoothly. And then if you look here, you are able to see that you do have 2 arteries and a vein there to be able to cannulate. So yes, and you are able to put a catheter in there and infuse those fluids at whatever rate or volume you need to.
Thanks. And then why don't we show them a little bit about how meconium can be integrated?
Absolutely. So again, one of those issues, again with newborns, is a concern of meconium aspiration, which is kind of a clinical emergency. So although SimNewB is not able to have fluids placed in the airway, you can simulate suctioning, which is important in a newborn. You have this, and this is going to be your simulated meconium. And how you would insert this is you're going to take this and put it down. There you go. So now you have your foreign body or your airway obstruction. At this point, just to kind of take you through, SimNewB, if he is having an airway obstruction, he's not going to be crying, but he will have no chest rise and chest fall, and those are the things that you're going to check for. So at this point, as a practitioner or clinician, I would then take either visual inspection or take a laryngoscope and kind of try to visualize if there's anything in there, because my laryngoscope has a light on it to see if there's anything occluding the airway. And so in that fashion or sense, I would then move forward with whatever protocol or policy I have for removal of that meconium, and then we would proceed with the simulation in that fashion. So this is your simulated meconium.
Thanks for showing that, Rotera. A few questions about draining out the fluid after infusing it. So how does that work?
Great question. So let's just talk about that for a minute. So I'm going to grab some supplies. Whoops. There we go. All right. So this is the drainage system that comes with SimNewB. So it's 3 components. So very simple. What you do, you have your drainage bag. Unscrew that. Unscrew this. Screw these guys together. All right. And then you will take your other component, and we like to match colors. So we're going to take those, click them together. And then lastly, you'll hook your drainage system to your port on your heel here. And it's just a lure lock, so you're going to twist that in place. And then you're going to have this hanging dependent below here like that to be able to provide that drainage, because SimNewB is a simulator. It does not absorb fluids, so that would be your drainage system for the IO. Now for the umbilicus, it's a little bit different. It's here on the side. If you can see that there, it's also a lure lock system, and you use that same drainage system to be able to drain the fluids. Now, when you're draining the fluids, you want to ensure that you're going to use sterile or distilled water. Tap water, not so much, because lots of fun things grow in tap water, and we don't want that inside our simulator. And you're going to want to make sure you flush it out after each use to be able to make sure those reservoirs stay clean.
All right, the next question I see that came in is, what kind of device is the monitor being shown on? And it's just a tablet that we have displayed for this demonstration. Next question, can SimNewB have nasogastric tube insertion?
Yes, there can be a nasogastric tube inserted into SimNewB. Also, he can have nasal intubation if necessary.
Are you able to build scenarios into the system?
Yes, using the LEAP software, you can use Sim Designer to create scenarios for the LEAP or for your Simpad.
And then does Laerdal have neonatal scenarios available?
Yes, if you utilize the Laerdal Scenario Cloud, there's a multitude of scenarios in there, including the 8th edition curricula for the NRP, as well as many others.
Right, and we also have a free 90-day trial for Laerdal Scenario Cloud, as well as detailed facilitation case guides that align with the NRP curriculum that you could use with SimNewB on our website. Next question I see is there any feedback during PPV? How much volume is being delivered, etc.?
There is no direct correlation to feedback as far as volume, but you are able to see that you are giving assisted ventilations within the Simpad software outside of SimNewB having spontaneous respirations on its own.
Right, and you'll also see that you get chest rise and fall when PPV
Correct.
is administered appropriately, correct. Someone is asking about the internal link box and then how it connects. So does it connect across Bluetooth or a wireless network?
It's going to be a wireless network that's created by SimNewB, and that's how all these interfaces are able to talk to one another.
Next question I see that came in is, when doing appropriate compressions at the correct depth, do you get a compression wave on the cardiac monitor?
That's a good question. I'm going to have to follow up with you, but I do believe that you do. We can, give me 1 second and I can answer that. Let's see. We can do it live right now. As you can see, I've put my patient in asystole, which is bad, but we're going to see if we can get that rhythm. All right. And yes, you do. So as you can see, I'm not giving high quality CPR, but I wanted to be able to show you that it does read that you are giving that CPR to your patient. And yes, I need to go faster. But yes, that feedback is available. And I have provided ROSC with a click of a button.
Thanks, Rotara. Next question. If you mimic pneumothorax, does the chest still inflate with PPV?
So if there is a tension pneumothorax on one side, let's see. I'm going to test this out for you right now just so we can demonstrate. I'm going to turn the baby back around so I can have great positioning. So, let's check. Looks like we still have bilateral chest rise and fall with that.
Thanks, Rotara. Next question. We actually have someone attending that is currently teaching with neonatally, and NRP vitals have not been working. So they're asking, is this only for SimNewB? And the answer is yes, neonatally does not have vitals. You can simulate them, but SimNewB is one that actually has the technology behind it to show the vitals on its own. Someone has asked a follow-up question about the tablet. Does the display tablet come with SimNewB as well? And no, the tablet is separate. We're just showing it during this demonstration. Let's see. Is changing SimNewB's eyes from dilated to normal a manual process only, or is there an automatic setting on the control software?
It is a manual process only, and again, you would just take your thumb or index finger, open that eyelid, and roll it to whatever setting you would like.
Another question, can we use Mac iPad for showing the monitor?
Unfortunately, no. Right now, it's only on the Windows interface.
Next question, can the umbilical cord be cut?
Yes, absolutely. So in your kit, when you purchase SimNewB, you will get not a multitude, but you'll get multiples of these, and you can cut them at your desired length to be able to insert them in the umbilical slot there. And you just use regular trauma shears or household scissors, and it's easily cut.
Next question I see is regarding SimMom. Can SimNewB be delivered by SimMom?
No, SimMom comes with her own baby, and that baby is delivered, and then the care thereafter is going to be demonstrated on SimNewB as that first newborn baby in that incubator or isolette.
Great, thanks, Rotara. Next question I see in is, how does the simulator get serviced or updated?
Great question. So with the updates, you can go to Laerdal.com, product downloads, and download those updates, or you can get on the phone with tech support for assistance. They're open 6 days a week. As far as servicing, you can there are a multitude of service programs that are compatible with your simulator.
All right, next question in that I see are, for a tension pneumo, can the learner insert in the mid-axillary?
So needle decompression is possible.
Next question I see is, can SimNewB be connected to a Philip monitor to show the vital signs?
So, as far as it being Philips, that is the interface in which is mimicked or simulated here on the patient monitor. So there can be no direct connection, but you can simulate that here to show that representation. So I'll go back to that monitor again, but this is modeled after the Philips monitor.
All right. Next question I see is SimNewB wireless only?
No, you can actually hardwire SimNewB if you need to. I'm not sure how well this will be visualized, but I'll show you guys. There is a Ethernet or Cat5 cable here that can be inserted into SimNewB to be hardwired into a wall. Also, you can use that area if you needed to for whatever reason. Hardwire SimNewB straight to the controlling device, which is the Simpad, or the computer that you're going to be utilizing. And there's an Ethernet port on the bottom of the Simpad as well.
All right. Next question, is the Laerdal scenario cloud an additional cost or included? And I touched base on that a little while ago with the 90-day free trial, but it is an additional cost. Next question I see is, can you use SimNewB with a Neopuff? And the answer is yes. We've actually done some testing globally with it, so yes. What size ET tube does the model take?
3.5 or 3.0.
A couple questions about a compressor. Does SimNewB require a compressor?
So the compressor for SimNewB is on the inside. There is no longer an external compressor. And due to the compressor being on the inside now, there is a concern about noise. But fortunately, we've come out with a feature within the software that's called Auscultation Focus, which shuts down that compressor to allow the auscultation of those adventitious breath sounds to be further auscultated. So therefore, even though the compressor is internal, that does not inhibit learners from being able to provide the assessment techniques necessary to complete their simulations.
Thanks, Rotera. Next question I see that came in is, can any surgical procedures be done on SimNewB?
No surgical procedures on SimNewB, not right now. SimNewB 2.0.
Yeah, it's more about focusing on those first 10 minutes of life.
Yes.
This is a good one. Is there a preemie version of SimNewB?
So no, but there is premature and that is a 25-week representation of a newborn, but that is the premature component that is offered through Laerdal.
All right, let's see. Next question. I'm not sure. Let's see how good you are. Can you demonstrate the pneumothorax mode and the process of needle decompression?
Unfortunately, I do not have a needle here to be able to provide that needle decompression. The recommendation, though, to do that needle decompression is to use a smaller gauge needle to ensure longevity of that component in that system, because it's only self-sealing to a certain degree. But from my practice and utilizing SimNewB in the past, you are able to hear the psst when you are actually needle decompressing. Granted, I haven't heard that in real life, but it is a good representation of when you want to utilize and do that skill or technique.
Great, thanks, Rotera. Next question I see, does the chest trans-illuminate with light if there is a pneumothorax scenario?
No. That is based on auscultation and visualization as far as having that chest rise and fall, as well as absent breath sounds.
All right, let's see. Does the fontanelle inflate and deflate?
No, on SimNewB, there is no fontanelle to be assessed or inflated or deflated.
Thanks, Rotera. How much fluid can be given via the umbilical?
So honestly, it's an open system. As far as the blood component, it's going to be about an ml of blood, because when you're utilizing the umbilicus in real life, it's not going to be a whole lot of volume. But as far as high rate infusions, because it's a kind of an open system again, you'd be able to run fluids just like you would based upon the diameter and width of whatever catheter you're going to insert.
Thanks, Rotera. Next question I see is, can you use CO2 for an ETCO2 detector?
No, it does have a simulated hold on. It does have a simulated EtCO2 or end tidal volume that you're being represented, but no, you cannot use real CO2 on the mannequin or simulator.
Just looking through to see if there's any other questions. Oh, you had mentioned about the operating system. Is there an advantage of using Simpad versus Leap?
It just depends on your needs. There's not an advantage or disadvantage either way. Portability is more or less what we're going to be looking at. So if you want to be inside to on the go, on the move, you're going to want to utilize your Simpad, as opposed to if you have a control room and you're always going to be running your simulations in the same place, you're going to want to use the Leap software on a PC or desktop or laptop.
Right, it's the difference between portability versus control room and what your preferences are. There's a follow-up question. Someone asked, can you explain what Leap is?
Absolutely. I'm glad you asked. Leap is the interface or Laerdal learning application that is utilized to run all our simulation equipment. So that is where you're able to go ahead and run the mannequin on the computer, create scenarios or themes, record sounds, access settings, different monitors that you can look at, access scenario cloud, and do your updates.
And then I guess a follow-up to that, can we configure gender of SimNewB through Leap or Simpad software?
Currently, SimNewB is ambiguous because the vocal sounds that match are just baby sounds, and for the most part, it's hard to differentiate between a girl cry and a boy cry. So right now, it's just gender neutral as far as it being a baby.
All right, next question in, does SimNewB run on a battery that needs to be charged?
Yes, so SimNewB is rechargeable. The runtime on SimNewB is right about at 4 hours, depending on how much you use it, and it can be utilized plugged in or unplugged.
Thanks, Rotera. Let's see, a couple questions about ventilators. Can Newbie be placed on a vent?
No, not at this time.
And I apologize if I mispronounce this, but can hydrops fetalis be simulated by modifying Newbie from the inside?
Not at this time, because then you lose some of the other features and components of the simulator.
All right, I think we've answered them all then. So thank you so much for taking the time to join our presentation today. You will receive a recording of this presentation via email in the coming days. In addition, your local Laerdal representative will be following up with you to answer any questions you may have. If you're interested in additional information about SimNewB, you can visit the URL on the screen. I hope everyone has a wonderful day. Thank you.
Thank you so much. I've enjoyed you.